This is our agency play group presentation brought to you by Julia Larson, Courtney Robeson, and William Welch. Welcome to the Hope Clinic. We are a full-service, outpatient treatment and home-based dual diagnosis facility specializing in medication management with therapy, groups, and individual therapy, offering holistic assessments. Organizational goals. Our goal is to assist our local community in outlining rural areas with quality service to help alleviate the co-occurring substance use disorder. We will achieve this by combating the addiction while ensuring clients' mental health is appropriately treated. The Hope Clinic's operational goal is to serve 50 clients annually with education, intervention, and treatment services. Our clinic will hold quarterly informational seminars open to the public on the topic of co-occurring disorders, along with being involved in advocacy at the state legislative level on an annual basis. The mission of the Hope Center is to change people's lives by delivering evidence-based treatment and compassionate care. We believe most substance abuse disorders have a mental health component that must be treated in order to successfully achieve long-term sobriety. Our values are simple. We believe in a non-judgmental, strengths-based approach. Our staff and providers are genuine and open with the clients we serve. We strive to build a trust-based relationship to foster healing and understanding, which is why we built our business model on the human relations theory. The structure of our agency is based on the human relations theory approach. This has several components. Those components include a strong collaborative focus, a focus on human relations. We focus on the strong emotional needs of our employees, symbolic participation by employees in decision making. The management encourages personal growth and agency development. We allow for flexible hours and adjusted work schedules to best serve our clients as well as our employees. Employees are to follow business casual attire to balance professionalism while still being able to connect with the client. We strive for client success. We operate on an open door policy and support from the top down. Employees are encouraged to use critical thinking skills.
Reviewing the organizational structure of the Hope Center, at the top of the hierarchy is the clinical director. The clinical director oversees a psychiatrist and a psychologist. Underneath the umbrella of the psychiatrist, they oversee the intake coordinators as well as the staff nurses. The psychologist oversees the therapist as well as the peer recovery coaches. Let's take a moment to meet our clinical director. The clinical director is in charge of setting staff expectations, ensuring that staff are knowledgeable regarding policy, provides support as needed, provides annual performance appraisals, oversees community involvements, ensures that the clinic is in compliance with all of OSHA standards, applicable laws, and the National Association of Social Work Standards. She writes grant proposals as well as mediates with client satisfaction issues. A psychiatrist. She works under the clinical director. She works collaboratively with team members, regulates, adjusts, and monitors client medications, and provides diagnoses for clients' mental health issues. This is our therapist. She also reports to the clinical director. Her job duties include meeting with clients to discuss their issues and trauma. She works collaboratively with the treatment team. She is an open and active listener, and she completes a comprehensive substance use disorder assessment as well as biopsychosocial assessment for mental health related issues. Let's meet our intake specialist. She acts as the gatekeeper for the agency and is the first contact between clients and services. She works with meeting incoming clients. She provides a holistic and comprehensive intake assessment. She also handles day-to-day clerical duties within the office, as well as billing and insurance claims, and she assists the team wherever needed. Meet our nurse. She reports to the psychiatrist. The nurse monitors the health of clients during detoxing. She consults on medication treatment. She also assists with dispensing medication as prescribed by the psychiatrist to ensure that it's taken appropriately, and she works collaboratively with the treatment team. Next, we will meet our peer recovery coach. The peer recovery coach reports to the therapist. She builds an open and honest relationship with the clients, empowers and encourages the clients, works collaboratively with the treatment team, helps the intake specialist with day-to-day office duties, and acts as an informal support to the clients as needed. Hi, I'm a therapist here at the SOWK Center, where we treat clients with dual diagnosis disorders, which are mental health disorders with co-occurring substance use treatment. The SOWK Center strives on providing genuine, compassionate, and evidence-based treatment. I can honestly say that we are doing great things here at the SOWK Center, and I'm proud to be a part of this team. I work together with a team of therapists like myself, peer recovery coaches, psychiatrists, psychologists, intake coordinators, and nurses to provide the highest level of care to our clients. Not only do I believe that we provide excellent customer service to our clients, but also we here at the SOWK Clinic strive for employee engagement, and this is a great place to work. I'm truly happy to come to work every day and do what we do for the community. I feel like our clients are highly successful because we hold them to a high standard while expressing non-judgmental attitudes and strengths-based treatment. I believe that our clients are comfortable here, that they come here and feel like they have a family and not just a treatment team. I've been struggling with mental health and addiction related issues for about 10 years now, and I've tried and not been successful in outpatient treatment in the past. I started going to the SOWK Center about 6 months ago. I was referred there by a resource coordinator at an inpatient treatment facility, and I was really skeptical about going at first, but I can honestly say that I've been more successful there than I have been anywhere in the past, and I think a big part of that has to do with my treatment team. I feel like they look at me as an individual and not as a number. They take their time with me, they advocate for me, and they really help connect me to the resources that I need. My therapist has been instrumental in helping me identify my triggers and help me stay on the right track. My peer recovery coach has been amazing. She's there for me whenever I need. I feel like it's someone I can call up and not feel like I'm being a burden to. I feel like my treatment team really wraps their supports around me, and they believe in me, and even when I make a mistake or do something that maybe they wouldn't necessarily think was a good idea, they're still there for me. They don't threaten to kick me out of services like other places have in the past. I feel like they're really a good agency in the community, and I hope that they stay around. I feel like I wouldn't be where I'm at today if it hadn't been for them. It's been a really good experience.
Challenges the clinic will face: lack of resources established in the area, such as mental health assessments and substance abuse assessments. Transportation for clients due to servicing a lot of rural areas. Clients establishing relationships with new providers. Due to staffing numbers being low, being unable to service a large number of clients. Ensuring that only quality evidence-based practices are being implemented. Quality of service using SMART goals: specific, measurable, attainable, relevant, and time-based goals with clients and organizational structure. Ensuring that the staff follow and adhere to the mission and values of the organization. Avoiding the 7 sins of service apathy, brush off, coldness, condensations, robotism, rule book, and runaround. Ensuring the climate and culture of the office has a positive impact on the staff and clients. At times, the client and treatment team may disagree on the method of treatment or ideologies. Keeping self-determination in mind, this is how the clinic will address conflict. We will establish common ground, emphasize the importance of communication, emphasize willingness to cooperate, emphasize with your opponent's perspective, evaluate both your own and your opponent's motivation to address the conflict, and come to some mutually satisfactory agreement.